Okay. Hi, this is your Sussex County chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic. I'm here with Pam today. Pam is here because she has mostly a lot of the pain is in her right ankle and foot. It's about a 7 out of 10. It's worse when she wakes up in the morning. She's got both knees are bothering her, with her right knee bothering her more. And then her neck is really tight, and your wrists and hands, correct?
Yes, that's right.
Okay. All right, so what we're going to do to get started is we're just going to do a little muscle work on her neck and her shoulders. So what you're going to do, Pam, is you're going to actually go ahead and face away from me, and you're going to put your arm out to the side like you're flying, and you're going to go across your chest. When you get here, grab this elbow with the left hand, pull it nice and tight, and then come back toward me, and repeat that. And as you do this, let me know if the pressure's too much, and if it is, I can go much lighter, okay?
It actually feels pretty good.
Good. So Pam is new today. She has not been here before. She's a real estate agent in Northwest Jersey for Realty Executives.
Yes.
Yep.
Right in Sparta.
Right in Sparta. Good. And come back. Pressure's still good?
Mm-hmm. Yeah.
So this muscle we're working on is, if you've watched any of the other videos we do in here, it's a pretty common muscle that I'm working on. This motion that patients do, pretty much everybody with neck pain is going to get this at least at first, because this muscle, it shrugs the shoulder blade, and with shrugging the shoulder blade, you know, that kind of happens with resting your elbows on armrests, happens when you're driving at 10 and 2 on the steering wheel. When you rest your elbows on a table when you're talking to someone, it's kind of just like, it's always in our life, in our society. So this muscle just goes from the shoulder to the back of the head, which is why if you use it too much, you get that neck pain and stiffness. I'll do this last one, good. And then you can relax that arm down.
Okay. You're dead on. That's exactly, you know, where my tension comes from.
Yeah?
Mm-hmm.
And then go across and grab that. And come back toward me again. And you can move a little faster if you want.
Mm-hmm.
That way you don't get fatigued with your arm. Good. So before we were filming, I was talking to Pam about sleeping positions. She says she doesn't use a pillow when she sleeps on her back. And when I'm curious to find out from you, Pam, after doing this treatment here, if you're able to sleep with a pillow afterward.
Okay.
And then I was also talking to her about a still point inducer, which is like this little rubber piece. It's very small, and you put it in the back of your neck, and it basically just keeps your head at like 0 tension when you're sleeping on your back. Yeah, I'm curious what's going to happen with both those things. And relax that down. Because you said you were going to buy one, right?
Mm-hmm. Absolutely.
Yeah.
I'm really looking forward to trying it.
I mean,
anything, really. It's going to
Yeah.
help my neck feel better.
And then hand on the low back.
Okay.
So you're going to go up in the air again like you're asking a question, and then
Okay.
down onto the low back again. Keep repeating that.
Okay.
Good. You busy today?
2 appointments, so
Nice.
not too bad.
Good.
Yeah. It's actually really nice because I'm hoping the sun will stay out.
Yeah, no kidding. This has been a very weird summer.
Mm-hmm. Pretty right. Needs to stop now.
Yeah. And one more. Do you do yoga at all?
I do, occasionally. I used to do it a lot more. I haven't re-signed up for a session in a while.
Okay. Do you find that helps?
I don't know if you've heard that.
Yeah. Little click.
Yeah, it's like that, and that's the side I sleep on, so I feel like it's correlated, you know, somehow.
Right.
Like when I swim, you hear it click too. Yeah, for the yoga, I was going down into Jefferson with a girlfriend of mine in this session that ended in the, I don't know, I guess early spring, and I haven't re-signed up.
So. Good, and relax. And you're going to tilt your head to the left, and then you're going to tilt your head to the right, and repeat that. Do you drive around a lot too?
Forever.
Really?
I live in my car.
Yeah.
I'm probably about 25 to 30,000 miles a year.
Okay.
time is in my car.
And relax that. We're going to go right to left now. So tilt right and then tilt left. Good. And one more. Good. Okay. Now we're going to go on your stomach, face down.
Okay.
Well, you kind of, if you slide up just a little bit more.
Okay, there we go. Perfect.
Yep. That's actually really common. People are like, where do I do? What do I do with my hands?
Right? Like, it's awkward. Same with
It's good that you
sleeping.
asked. Yeah.
Right?
They're just in the way, right?
They're just in the way. It's a bad design. Model flaw.
Well, if you sleep on your back, they're not in the way. And that's like the most
Right.
neutral you can put yourself in.
Yeah.
The most neutral position is when you sleep. So I'm working on your calves now to help with your foot.
Okay.
Okay? And the left foot doesn't bother you, it's just the right, correct?
Mostly the right, sometimes the left.
Sometimes the left, okay. Do you find that your foot bothers you less when you're doing yoga more regularly?
It's hard to say. I didn't really correlate that, but maybe.
Okay.
I mean, I do know it feels better to stretch, and I try to do that, but it doesn't really alleviate the pain totally.
Do you ever use like a tennis ball and roll your foot around on it?
No.
Okay, I'll show you that too.
Okay.
And then you can also do the same sort of technique with a frozen water bottle.
Yeah, I know that one for the neck. That's great.
Oh, did you do that?
Mm-hmm.
Did it help?
Yeah, I like it.
Nice. And so the hamstrings are for helping out the knee.
Mm-hmm.
So we're doing this in here. This isn't too bad though. And you're driving an automatic car, not a manual shift? Okay.
Right, yeah.
Yeah, typically the right leg is tighter for people who drive a lot because of the pedals and everything.
I do, like I said, I do try to stretch out.
And then you mentioned swimming too. How often are you doing that?
When it's not monsoon season.
Yeah.
Every day.
So you swim outside?
Yeah. Yeah, I try to, maybe half hour, not anything crazy.
Right. You're not like swimming like for 10 miles or anything like that.
I wish, but no.
That takes so much time is the thing. Like,
It
not just
does.
swimming 10 miles, but like training to get to that point.
That's right,
It's like,
getting in
oh
that
my God.
condition. For anything, for sports. Whoops,
Yeah.
sorry.
That's okay. I need that to come off anyway when we're doing the foot adjustments later. So you're really just speeding up the process.
There we go.
And the left knee bothers you, but not that much.
The right knee more so, but at times, it's weird. Overuse just destroys it. And it's just like you say, I have to walk around. I can't not do that. So I just have to deal with it.
You go for massages ever?
Very rarely.
Right.
Very rarely. I should. One time went to Shannon. I really did think she was wonderful.
She's pretty impressive, huh?
She really is. Just her energy too.
Yeah. Okay, we're going to get into some adjusting. All you got to do is take a breath in and out. We're going to go really light. Good. And again here. And here. Doing all right?
Yeah.
And then here, in and out. And one more. Good. Let's go on your back, face up.
Okay.
You moved really well.
Good. Does that mean I'm going to live?
I think so.
Yay!
I'm pretty confident.
Alright, that's a bonus.
Alright, let me grab this stool. I'm gonna get a little more work done on the foot here.
Okay.
Are you ticklish at all?
Not typically.
Okay.
The only other issue that I have with my feet is that they cramp. Like I get really, really bad foot cramps.
Would you say you drink enough water every day?
Probably not.
Alright. I want you to think of how much you weigh right now.
Okay.
Divide that number in half.
Mm-hmm.
That is how many ounces you need to drink a day of water.
Okay.
I'm assuming, and I'm definitely right, that you weigh a lot less than I do. I drink half my body weight in ounces of water a day.
Wow.
And it's not hard. It actually, once you start getting into the habit, your body craves it, and you'll be more thirsty in a way.
Yeah.
And if you start doing that, that'll really get rid of the cramps completely.
Yeah. I definitely know that I should increase that. My challenge is that being in the car as much as I do,
right,
without access to any
restroom or something.
You know, it just becomes, excuse me, a challenge.
Yeah, that's a good point.
So I do like limit, if I have a big showing day where I am going from one client to the next, I probably will avoid water, like altogether. I'll take tiny sips just to get anything.
That doesn't make it easy, but trying to at least shoot for it maybe on the weekends or when you're not working at least.
Right.
You know, you probably work on the weekends, right?
Sure.
Yeah.
Sure. It's actually been very busy lately, almost every day.
Good.
Yeah. Yeah, it is good. Yep.
Pain with that?
No, my thing is that with the knees, they used to pop out all the time when I was a kid.
Right.
So, like, my husband would say, if anybody goes near my knee, I freak out.
Okay. And relax this. I'm just going to do muscle work on this wrist.
Okay.
In addition to the water, though, every day, try to get a coconut water or smart water.
Okay. For electrolytes?
Yes, exactly.
Okay.
Do you like coconut water?
I do. I really do.
I only recommend 1 to 3 times a week. You can go more than that, obviously, but that's really all you need to get rid of the cramps.
Okay.
But that'll help a lot. Because those cramps are definitely really annoying.
Oh my goodness.
Yeah.
Yeah, they're crazy.
Yeah. Okay. Let's bend the left knee. And foot down on the table. Cross your arms here. And then rotate toward me here. This is for your low back adjustment. Go ahead and keep your head back there.
Okay, yeah.
Yep. And then give me a breath in and then breathe out. Good. Good. Go flat on your back. And you can straighten that knee out if you want. Do a little work on this knee. You go hiking at all?
I like to, but I don't do it very often.
Right.
My husband's not a hiker. And it's funny, too, because he wants to go to Iceland this year.
Okay.
And pretty much, if you go to Iceland, you gotta hike.
Yeah.
So he's thinking about changing his destination.
Oh, really?
Yeah.
I was gonna say. I thought you were gonna say he's thinking about getting into hiking.
I would. No. He had back surgery probably 15 years ago, and he's got like a peg leg, you know.
Mm-hmm. Breathe in and out. Good. And go flat on your back. Yeah, probably not the best then to go hiking. What about like flat ground hiking? Just walking on trails?
Well, even just taking a walk. You know, he would rather cycle than he would walk. Me, I would rather walk than cycle. So we're kind of on opposite schedules.
Right.
He'll do like 30
Wow.
Yeah, he loves it. They did the 5-borough ride, him and my son. It was great.
Wow.
Yeah, it was cool.
Is that just a full day?
Yeah, pretty much. And of course, my 18-year-old son, thinks he could just jump on a bike and do 100 miles.
Yeah. How'd he do?
At the end, he's like hangry,
Yeah.
He wants to hurt somebody. He's so done.
Yeah. No, that's a long ride.
It's a long ride, even flat,
Okay, I'm gonna adjust this wrist here. This I'm gonna work on first, though. This muscle's a little tight. And it's this hand that you have trouble opening bottles? The right one, no problem, though.
Yeah.
And it's a screw top bottle, right? Like a water bottle?
Yeah, like a water bottle. Forget it. I can't do it. I get a pain, like a sharp pain.
Okay. Relax this.
Okay.
Well, that didn't move at all. That was like popcorn, huh?
Right?
Wow. And relax this. Good. Okay. I'm going to do muscle work first. Then we'll get into the neck adjusting, which you've had before, so you know what it sounds like. You gotta tell people, especially when they're for their first adjustment, what to expect in regard to the neck.
Yes,
because it's so loud.
It is. It is.
From anyone else's point of view, other than the patient, it's not really that loud. But for the patient, it's like, whoa.
Right.
Because bone conduction sound is different than air conduction. And relax this here. You have great range of motion. That's good. Okay. Let's get adjusted here. Relax your head. Good. And relax the side. Good. Let's make sure you're even here with the motion laterally. Got one more spot, a little baby one. Good. Okay, Pam, let's come up. I want you to try out that neck. Definitely.
That's not
There
pretty.
you go. Try to move your head from side to side.
Yep.
It's good.
Yeah, that's good.
And how's the foot? Try standing. Was there any motion or any position that was bothering you before?
No, like when I was laying down to have the blankets on my foot, I felt like it was hyperextended, for a period of time, and then that's where in here would start to hurt.
Okay.
But sometimes it's in here. It kind of floats around in that foot.
When you point that toe now, does it bother you?
No, right now, no, not at all.
I want to do something ambitious here, but I want to see how it goes. Give me 1 second.
Okay. Feels pretty good, actually.
Alright, let's see. I want to see you open this with your left hand.
Alright.
If you can. If it hurts, don't do it.
I have the pain there, but I can do it. No, I can't.
No? Okay.
Sorry.
Where does it... No problem. Where does it hurt when you do that?
Like right in here.
In the pointer finger
right
more?
In here, yeah. It just shoots a pain right in here.
Okay. Then we have to work on this too.
Yeah, it's just like, see, like, you do it like that, and oh man, like right here.
Right in there?
Right here.
Did you ever get your hand x-rayed?
After the car accident, because what happened was, it was kind of like T-bone. I hit somebody else, but in the middle, they cut me off, and this wrist crunched. It like just crumbled, from the force of my body still moving forward and holding onto the wheel. This crumbled. This turned black and blue, like purple.
Okay.
And I did have it x-rayed, but they didn't find any break at the time.
Okay.
But I always felt like they repaired this one. I was like, yeah, this is pretty good. This one, I always felt like it had some issues.
Some issues still? Okay.
Yeah.
Well,
and it's just gotten worse to the point where, like, I really can't use that.
because you have a little bit of like a knot in here.
Mm-hmm.
Is this tender at all?
No. Mm-mm.
Good.
It's just all like this here.
Right. So I'm checking here because these muscles go into here.
Mm-hmm.
So, but I definitely want to work more on these fingers in between.
Mm-hmm. Right, like right where you're touching, pretty much.
Pressure okay?
Yeah, pressure's okay, but I feel it.
Right.
You know.
It's definitely tight.
That's why I was, that's part of the reason. I'm like, oh gosh, I can't even open a bottle of water anymore. That's ridiculous.
But you can do it with the right hand.
Oh yeah, on
so
my teeth though.
At least there's that. Oh, your teeth. Yeah, that's not going to be good for your teeth though. But that's good that you can do at least the right side. There's some people who can't get either side, so
True.
Not that I'm trying to make it sound like this is not a real problem, but
right there.
Yeah. So these muscles in here, in between your finger bones, your metacarpals, and they're just tight. So I'm going to show you some stretches to get this loosened up too.
Very often when I'm driving, I'll take my hands off the wheel and I'll do one of these.
Okay.
And like I'll get cracks and snaps.
Yeah, and I noticed that too with your wrists when we were working on them, because they were just popping before I even did anything. Is this less tender? Or is it still sore? Yeah, it's still painful, right?
Yeah.
Is that thunder out there?
They were calling for more rain.
Really?
Yeah, my car tells me like flash flood warning.
Yeah, they had one of those on Saturday or Sunday. I think it was Saturday. I got a notification. And your phone like locks. It's like really annoying. It's like, oh man, flash flood, be careful. Sore in there, or you're right?
It's okay. I feel it.
Yeah.
But it's more like a feel-good stretch than it is zowie. That's a pain.
Okay, good. And is it only water? It's like only bottles? It's not like can openers or anything like that? Any other thing you're gripping?
Yeah, no, I think everything else I'm gripping is okay. I mean, the more I drive, the more sore my hands and wrists are, the less I want to do when I get home.
Right.
Kind of thing, but the only thing that I really realize, like even at my best, I'm not able to really do that without pain.
Right. Okay. Let's grab that bottle one more time.
Sure.
I want to see if it's any bit better. Okay, it's tight.
It actually is better. Yeah. Yep.
Still hurts a little bit?
Yeah.
Okay.
Yeah.
Okay, so...
But it's not as sharp.
Well, that makes sense.
It is better.
Okay. That's good. So
I didn't think you'd be able to do that.
Yeah. Well, I can definitely keep helping you with that too, get you complete relief one day. But what that makes it makes sense to me because if you get an x-ray and nothing shows up, then it's a soft tissue problem. So the muscles are just really tight in there.
Got it.
Which is why when I'm doing it, you're like, ah, that hurts. So we just got to keep loosening that up.
Wow, that's really good.
I'll show you the stretch for that, and then I'm going to show you the stuff for your foot.
Okay.
But any questions at all?
No. I think that's good. That's really good.
Well, thanks for bearing with us, guys. Thanks for watching the end of that. I'm Dr. Will Holdsworth, your Sussex County chiropractor from Pain Relief Chiropractic. This is Pam from Realty Executives, Northwest Jersey, realtor. Thank you for watching again, and have a good day.